I mean, it sounds like something straight out of a horror movie, doesn't it? But this isn't fiction. This is the very real, very dangerous process that can happen during pancreatitis. And that question, it really gets to the heart of what we're going to break down today.
So here's how we're going to break it all down. First, we'll get to know the pancreas itself and what happens when it's under attack. Then, we'll dive into the two very different forms of this condition, learn the warning signs, and find out who the main culprits are. We'll also cover what happens when things get serious, and then we'll finish up by looking at recovery and, most importantly, how to prevent it.
Okay, so first things first. Before we can really understand the attack, we've got to understand the target, right? The pancreas itself.
So what exactly is pancreatitis? Well, at its very core, it's just inflammation. Think of it this way. Something injures your pancreas and your body's internal alarm system goes off. It sends in the troops, your immune system, and the result of that battle is intense, painful swelling.
And here's a cool thing. You can actually get a feel for where this organ is right now. Go on, try it. Just lay your hand flat across the top of your belly, right below your ribs. That small, kind of leaf-shaped organ tucked way back there, that's your pancreas, working away silently behind the scenes.
And believe me, this organ has a massive job. It's like a dual-function powerhouse. On one hand, it's a factory, churning out the enzymes you need to break down food. And on the other hand, it's a command center, producing crucial hormones like insulin to keep your blood sugar in check. So you can see why when this one little organ gets into trouble, it can set off a domino effect through your whole system. Okay, this next part is absolutely critical to understand. Not all pancreatitis is the same. It can follow two totally different paths. One is called acute, and the other is chronic. And this really shows the difference perfectly. Acute pancreatitis, on the left, it's kind of like a sudden explosion, a temporary fire. Now, it's serious, don't get me wrong. It's responsible for something like 275,000 hospital stays in the US every year. But with treatment, the fire goes out. Chronic pancreatitis, though, that's a slow, smoldering burn that just never really stops. It causes progressive, permanent damage over a long period of time.
So how does your body even let you know that something's wrong? And what's really behind this incredibly painful condition? Let's do some investigating.
This right here is the #1 signal, and it is not subtle. We are not talking about a little stomach ache. We're talking about a moderate to severe pain, usually in the upper abdomen, that a lot of people say feels like it's boring a hole straight through to their back. This is your body's alarm bell, and it is ringing loudly.
And what's really telling is how the pain behaves. Certain things just make it flare up. Lying flat on your back, coughing, exercising, or even just trying to eat a bigger meal can make that pain way more intense. These are all huge clues for doctors. On the flip side, people often find some relief by changing their position. Sitting up straight and leaning forward a bit, or even curling up into a ball can sometimes ease that pressure and pain. It's the body's natural instinct to try and find some comfort.
So, what's causing all this chaos? Well, just look at this chart. The numbers are pretty shocking. A massive 80%, 4 out of every 5 cases of pancreatitis come down to just two main culprits: gallstones and heavy alcohol use. Yep, while other things can cause it, those two are the undisputed heavyweights.
And when it comes to gallstones, this is the devastating chain reaction that happens. First, a little stone gets stuck and creates a roadblock. This traps all those powerful digestive enzymes, leaving them with nowhere to go. So pressure starts to build up inside the pancreas. Then, those trapped enzymes do something they should never do. They switch on. They activate inside the pancreas. And that's the moment the organ literally begins to digest itself.
Okay, so now we have to talk about what happens when things get really serious. What are the potential complications when this isn't just a temporary problem?
Now, the good news is that most acute cases, we're talking 4 out of 5, are pretty mild and resolve, but that leaves a really significant 1 in 5, or 20%, that becomes severe. And that's when you get into potentially life-threatening territory.
And when a case turns severe, we are talking about life or death situations. Things like parts of the pancreas tissue actually dying off, massive infections spreading through the bloodstream, or the body going into shock, which can cause multiple organs to start shutting down. This is exactly why any symptom of pancreatitis has to be treated as an emergency.
Now, with the chronic kind, the damage is more of a slow burn, but it is just as devastating. Over time, the pancreas just can't keep up. It loses its ability to make enzymes, which leads to malnutrition. It stops making enough insulin, which causes diabetes, It can result in constant, awful pain, and unfortunately, it even increases the risk of developing pancreatic cancer.
All right, after all that heavy stuff, let's shift gears and talk about the road to recovery. How do doctors even diagnose this, and what does treatment actually look like?
So doctors have a few key tools in their toolbox to figure this out. They'll almost always start with a blood test, looking for high levels of pancreatic enzymes. Then, they might use imaging, like a CT scan or an MRI, to get a direct look at the organ and see the swelling. And for those cases where they suspect it's chronic, a stool test can actually tell them if the pancreas is still making enough enzymes to do its job.
When someone has an acute attack, the main goal in the hospital is all about supportive care. That means giving them lots of IV fluids to stay hydrated, managing that severe pain with medication, and making sure the body gets nutrition while the pancreas just gets to rest and heal. And, of course, the big one, treating whatever caused it in the first place, like getting that problem gallstone out of there.
And that brings us to, honestly, the most important part of this whole discussion, prevention. How can you lower your risk, and what does the long-term outlook look like?
And you'll see that prevention really comes down to lifestyle choices, things that reduce stress on the pancreas. Moderating how much alcohol you drink is, without a doubt, at the top of the list. Quitting smoking is also huge. Eating a diet that helps you manage your cholesterol can lower your risk of gallstones, which, remember, is the #1 trigger. And if you've already had an attack caused by gallstones, talking to your doctor about removing the gallbladder is often the best move to make sure it never happens again.
You know, it's funny, we don't really think about our internal organs until they start screaming at us in pain, right? But your pancreas is this vital, hard-working part of your body. So after seeing everything that can go wrong, the real takeaway is a question we should probably all ask ourselves. Are we listening to what our bodies need before they're forced to demand our attention?